In this video, I'm going to focus on the components of the ultrasound image where it refers to the MI and the TI, as well as the description of the probe here. MI refers to mechanical index. The MI is a measure of the potential for mechanical effects such as cavitation, which can occur when ultrasound waves create bubbles in tissues. So the mechanical index is primarily based on the peak negative pressure of the ultrasound wave and the frequency of the ultrasound. It gives us an indication of the likelihood of cavitation occurring. When you have high mechanical index, these are typically associated with lower frequency ultrasound waves and higher pressures and can create more mechanical effects such as microbubble formation, which can be harmful in some cases. The mechanical index is also going to change if you use a contrast-enhanced ultrasound. If you're doing contrast-enhanced ultrasound, you don't want the microbubbles to pop necessarily. Keeping the mechanical index really low is important to preserve the microbubbles. However, if you want to destroy the microbubbles, increasing your mechanical index can be helpful. So this is the MI of 1.0. When we're dealing with the TI, that refers to the thermal index, which is related to the potential for thermal effects or heating of the tissues being imaged. In this case, the thermal index is 1.3. When you have high thermal index, there is a greater potential for heating the tissues, which can be concerning in certain situations. Why is it important? It's really important to making sure that we don't inadvertently overheat certain tissues. This may be important, especially in developing tissues like those of the fetus, to make sure that the thermal index is kept low. And then finally, we see over here that this is a C16. This refers to the probe. There are a few main classes of probes, but the C refers to it being a curved probe. Sometimes you'll see an L before it, which refers to a linear probe, or maybe even an S, which refers to a sector probe. And then the number afterwards usually indicates the frequency of the probe itself. And then here we can see that the C16 probe has been set on the abdomen setting. And so these are important components when we're looking at ultrasound image. And I just wanted to focus on the mechanical index, the thermal index, as well as the curved probe or the type of probe that you're using.